This video is going to be an instructional video for those people who will be home taking care when there's quarantining and if this virus gets serious here in the United States. And I'm going to assume that you're a female, but that doesn't necessarily mean it has to be a female. And I'm going to assume that you're home, and it could be you, your spouse, and all your children, because if the schools become closed because it's widespread, then your children will be home with you. But specifically about home care skills, what are the kind of things you are going to be doing? What are the kind of things you're going to want to be ready to do, have supplies to do, have knowledge to do? All right, hang on and we'll get right back to it. And we're back. So you're going to be a home health nurse is basically what's going to happen. You are going to be needing to do certain things during this virus. One, you're going to want to be checking people's temperatures. And in the good old days, you used a mercury thermometer. You shook it down, then you stuck it in, then you read it. You had to turn it so you could see where the marker was. Nowadays, you have a couple of options. One of them is the forehead thermometer, where you just roll the thing over the forehead, and the other one is the digital one that still goes in someone's mouth. Luckily, the digital ones come with little covers, so you don't have to have the same thermometer going in everybody's mouth in case someone is sick. You can throw away the one they touched and put a new one on there. You're going to want to wear those nitrile gloves whenever you think someone might be sick. And you're going to want to have the masks for the ones who are sick and you're not trying to spread that sickness to the rest of your family. You might have to quarantine someone in their own room in your own home. You may have a sick person and the other three of you are well, and so they're going to have to stay in their room. That's a really good time you got to think about this stuff. How are they going to go to the bathroom if you want them to stay in their room for 2 weeks? Or if you're going to have them use you only have one bathroom in your house and they're going to use the one that everyone else is using, you're going to have to go in there after them and disinfect everything. You're going to have to wash it with something like a bleach solution without touching anything that they touched yourself. So you're going to have to wear gloves and like some protective clothing. You're also going to want to you're going to have to wash that protective clothing after you've cleaned that bathroom. So you're going to need your washer and dryer running. If you don't have them, if you're off grid like me, you're going to have to wash those things in hot water by hand and hang them up, and hopefully they're ready next time. Another option would be using that composting toilet that I talked about, which would have to be changed out, but the person in the room could put that toilet outside and you give them a fresh one and you take their waste out to your human manure compost area. You could do that, disinfect that bucket when they hand it out to you, take it out there, dump it, you disinfect and clean the outside of it, get it ready to be used again, and then have that on standby for that person, and that way they don't even have to leave the room. Same thing with food. If you're going to feed that person, then you would put their food in a one-way situation. Like you make it, put it in a Walmart bag, they take it. They're not giving that Walmart bag back. They keep it in the room in a trash can, which you'll burn after it's all over. And then on something disposable. Like sandwiches are a great food for something like that, because the sandwich can be, you could wrap it in a paper towel, you can put it in a plastic bag. You don't have to have a knife, a fork, a plate, all that. They can just eat it. And they're going to need water in there and juices. So all that stuff, if you give it to them, if it's coming back out, you got to disinfect it before you interact with it. With what other disinfectant you're using, like I said, a light bleach solution, you may have a Lysol spray, you may have some other kind of medical disinfectant spray, but it's going to have to be every single time, and you're going to have to be protected too, so that you are not catching it yourself. Wash your hands, wash your clothes after every interaction. It's going to be kind of intense. If they're actually sick, then you're going to have to be on top of their medications. You're going to want to make sure they have painkillers. I've talked about Mucinex or blackberry root, astringent like mucus, it dries them up. They might need something like a Dayquil, NyQuil, cough suppressant, cough drops, honey lemon mixture, whatever your version is to help them sleep at night. And a decongestant, meaning, it stimulates you to cough and blow your nose to get the mucus out of your system. Those things will be necessary at the very least to treat them. Excuse me. So as a home caregiver, you're going to be dispensing medication, you're going to be checking stats, you're going to be checking what their fever is, listening in on their coughing. Are they coughing productively? What color is their mucus? If the mucus gets dark brown or a thick green, that's a problem. There's an infection going on. And then if you have, say, your penicillin or something that you've stored up, you're going to administer that and keep track of those dosages. Make sure they're given it at the right time, every 3 or 4 hours, every 6 hours, every 8, whatever it is. Motrin twice a day. You're going to want to probably have some kind of clipboard or paperwork so you can keep track of all of that. Or if you're doing all the herbals like echinacea and garlic and so on to help control that bacterial infection. And at the end of the whole quarantining period, everything in that room needs to be washed. You remember seeing on movies and stuff like that with scarlet fever, which is a bacterial deal, and it's the basis for things like strep throat. Everything in that person's room would be dragged outside. They burn the mattress. They boil all the clothing, the curtains, the blankets, everything. That's going to have to happen in this coronavirus outbreak. Everything, you can even spray the walls down with the decongestant, cleaning the carpet. It's a lot of work. But it's worth it to go through it if you can keep, the illness from spreading. And keep in mind that cats and dogs, pets, can get a coronavirus too. So you're going to want to be careful that they are not a carrier. You can't have the cat going in there where the sick person is, interacting with them, coming back out, and then interacting with you. It's not going to work. So that's just a few of the concerns your home nursing situation covers. And there's probably more, and if I can think of more, I will put another video out. All right. Bless you. Stay with the Father. Shalom.